We chose the 5 different domains elaborated by the Studer Group to best determine what we would measure within our scorecard, because there's many different methods to determine quality and measure quality in physicians. So the 5 domains that we selected were quality, service, finance, growth, and people. And by looking at these 5 domains, we feel that we get the entire breadth of what would make the quality physician and the ideal physician within our practice. Of the 5 pillars, the first that we chose to measure is quality. True measurements of quality, for instance, patient outcome reported metrics, can be difficult to achieve, and that's our ultimate goal. Currently, we're doing more compliance metrics to include signing and dating of charts, the CPT and E&M audits, and then lastly, qualifying for meaningful use criteria with CMS. The second of the 5 pillars refers to service. What we're referring to here is the quality of service, the level of service that our physicians provide to the patients overall. And so what we decided to do was to measure the Press Ganey survey specific care provider questions on every new patient and every established patient after 3 months. And so by honing in on these care provider specific questions, we can really determine the best practices, who are the doctors that provide the best level of service to our patients overall, and how do we extrapolate that across the group so that everybody can improve. The third of the 5 pillars refers to finance. When we first decided to roll out the scorecard, I specifically didn't really think that finance was a good pillar because we're already rewarded in terms of finance in our practice. However, I was persuaded by some of our group leadership that one of the issues that we had was certain physicians would hold on to their charges and not turn them in appropriately. And this actually affects the group overall because then it definitely affects cash flow. So we determined that the ideal Resurgens physician would be one who was financially responsible to turn in their charges in an appropriate period of time. It didn't affect their pay, but it helped the company run overall as a group. The fourth of the 5 pillars refers to growth. This is the ability of the physician to do things within the company to help the company grow overall within the Metro Atlanta market. So specifically, we look at 2 different things. One is the Press Ganey provider question that specifically refers to, would you recommend this provider? We feel that this is overall the most important question on the survey. The second one is activities that the physician does within Resurgens, within the hospital, within state and local organizations and national organizations, and within the community overall to raise the name of Resurgens within the Metro Atlanta market. The final pillar within our scorecard refers to people. Specifically, physicians could have incredibly high quality measures in terms of clinical skills, but can overall treat other people very poorly, and this would certainly not be the ideal physician within our group. So we survey our physicians with 10 specific questions and the teams that our physicians work with 10 specific questions on an annual basis. And these questions really hone into the ability of the physician to work as a team member and to treat people with dignity and respect. Our physician scorecard will evolve over time as we determine certain metrics, some that we do very well that we don't need anymore, and some that we haven't determined yet that we need to add in that we need to focus upon. Specifically within our scorecard, we'll probably drop off meaningful use as CMS criteria continues to change. But in addition to that, we'll probably also add in the patient-reported outcomes metrics as we determine the more technological methods to have this happen.